Hello, everybody. We are so happy to welcome you here today in Hero Hub, and we just waiting our guest. Francesco Della Villa will join us now. Hello, everybody who is joining us. And yes, we are waiting for Francesco. Francesco is here. So now he will join the stream. We have amazing guest today. Please be ready, everyone. Hey, hello.
Hey, ciao Irina.
Ciao. I'm right from Italy. I am so glad to hear you.
So glad to see you too. How are you?
I'm perfect, amazing. Here in
Good.
Spain, the weather is amazing.
Oh, even in Italy, it's pretty hot, but I have good air conditioning over there in my office, so it's okay.
It's okay. I think we are okay. So welcome everybody who is joining us on the live stream. And for the very beginning, let's start with the introduction. We introduced you a bit in our stories, but of course, it's great to hear from you from the first part.
Oh, absolutely. My name is Francesco Della Villa. I come from Italy. I'm a sports medicine physician by an academic point of view, and working inside the Isokinetic Medical Group. The Isokinetic Medical Group is an international medical group. We are a network of center of excellence in working in sports medicine and orthopedic rehabilitation. And the whole network is managed by general direction, and the heart of general direction is the education and research department. That is a sort of internal university HR facility, whatever you want to call it. And I'm the director of this department. So my whole life is about education, research and development, scientific activity, and real life implementation in our centers of the news from the world and from our studies. And so this is a little bit what I do. In terms of as I grown up, I had an international education, so I've been traveling a lot, both in the medical school and afterwards in the residency, and even now. And I mainly traveled in US, and I did my fellowship in California, in Santa Monica, 1 year. Was a beautiful time. Even in Los Angeles, the weather is good, Irina, and maybe not as good as in Spain, but I promise, pretty good. And so that's it. My main interest in terms of scientific activities are lower limb injuries, in details knee injuries, and if I want to pick one, ACL injuries, from the video analysis of the injury mechanism until the complex return to play process that we study every day. My main background is biomechanics of knee and ACL injuries.
Perfect. Thank you so much for the introduction. And I'm really great. And I'm really happy to have you here, like to hear from the first part, from you part about this very important part of athletical activity, the low limb injuries. And when you were speaking about the Isokinetic Group, I remembered when I was in London, in Isokinetic London, I really was fascinated about how everything is organized, how all the scientific tools are implemented into the practice, and how the recovery protocols are well established. So it's great to have you here and to speak a bit about all the changes in terms of the epidemiology of the low limb injury and about the recovery. And actually, from the very beginning, I would love to start with a very easy thing. Some of people who saw our online announcement for today asked two questions, like, what about low limb? What is this? And you precise this. This is the ACL injury, knee injury, and other injury related to our foot. And another one, what is multidirectional sports? So there are people who was asking about this. So let's be a bit clear for the people who are not involved in the medical and sports science terminology.
Absolutely, absolutely. So let's start from here. Lower limb is really the whole lower limb, from the pelvis to the foot. So when you are dealing with lower limb injuries, we are dealing with hip and groin problems. You are dealing with thigh problems. You are dealing with knee problems, leg, that means the calf problems, and foot and ankle problems. So from the hip, from the pelvis, why as human beings, we are still adapting to the upright position. And so we are still fighting with gravity. And in this fight with gravity, in this natural compensation through the centuries against gravity, I mean, the lower limb is a connection of the other part of the body and the ground. And in this extent, it's pretty easy to have problems, to have an acute overload with an acute injury, or a chronic overload with the chronic overload of a tissue or mixed tissue of one of the parts, mainly, for example, knee pain. So a lot of people develop knee pain in their life, probably 30–40% of the whole population. And it is about a chronic overload. It's about gravity. So lower limb is really from the pelvis to the foot, and it's about really this gradual adaptation to gravity that our species is really experiencing as we are talking. And what about multidirectional sports? Multidirectional sports are my favorite sports because multidirectional sports are generally team sports. I mean, not everyone, but generally team sports. So we are speaking about football, we're speaking about basketball, we're speaking about volleyball, we speak about rugby, American football, ice hockey, field hockey, cricket, whatever you want. It's a group of people that is doing not just one activity in straight lines, that may be linear running, but also changing direction. And this change of direction are pretty challenging if you consider this in the context of lower limb injuries in general. Then there are also the jumping and landing activities and all the sport-specific activities that may elicit really specific tissue overload and injuries for the sport. So lower limb from the hip to the foot and ankle, and multidirectional sports, think about football, think about rugby, basketball, whatever you want.
Perfect. Thank you so much for the explanation. And from the very beginning, I think it will be great to start with a bit of epidemiology in terms ACL injury is one of the most common injuries in lower limb, but there are other injuries. So could you please precise which percentage of different type of injuries are often in the multidirectional sports?
Yeah, if we consider by an epidemiology perspective the injuries, for example, giving the example of football. Football is the most played sport all around the world. The most frequent injuries are for sure the muscle injuries, namely of the thigh, and the posterior part of the thigh, so the hamstring injuries are clearly the most frequent ones in general. But consider muscle injuries of the lower limb, number one. But if you consider really the severity of the injury, one of the most severe injuries is for sure the anterior cruciate ligament injury, so the ACL injuries. And everybody knows about the ACL injuries because they are in the news, etc., etc. Why I'm taking just these two examples? Because if you consider the injury burden, so really you couple the frequency of a certain injuries with the severity, muscle injuries and ACL injuries are the most important in football. And this is the reason why we are speaking about speaking about them. So by an epidemiology perspective, these are the two most important. Then we can also talk about, for sure, foot and ankle injuries, so the ankle sprains that are not simple events, but can really have sequela. So it's something we need for sure to address. And the chronic conditions like what we call the patellofemoral pain. That means knee pain. Knee pain is very frequent, especially when there is a transition, the transition really between the teenage really and the adulthood. So by epidemiology perspective, this is the situation.
Perfect. So now we know a bit more about the injuries, and I think now will be great to know, like everybody would love to know two main things about how avoid the injury, and then if you had an injury, how to recover it. I think these are two hot topics that are on the table. So let's start to speak about the prevention. So what can we suggest to athletes, novice athletes, elite athletes in this term?
Absolutely. Prevention. This is a very, very important topic, but also very difficult to speak about. Why? Because when you think about prevention, you think about 100% prevention. So you prevent, and that's it. So in reality, we are speaking about the injury risk reduction approach. So there will always be a certain amount of injury, but we can control them applying a certain training, and applying not really a training, but really a model of thinking model. And this is about adopting an injury reduction philosophy. What does it mean? There are, and they are published by 20-25 years, injury reduction programs. Injury reduction programs are really easy programs at the end of the day. They are not difficult. They are a mix of exercises of various nature, mainly neuromuscular training exercises. That means that you don't work just on one muscle, but you work a little bit on the lower limb kinetic chain, so on all the muscle and the structure of the lower limb. And these exercises has to be done at least 3 times a week. Generally, they are not very time consuming. So 20 minutes every time. So 20 minutes, 60 minutes in total. This reduces by 30-40% all the injuries, and by 50% all ACL injuries. In women athletes, and we are seeing the rising tide of women's soccer in women's football in Europe nowadays. With these programs, there is a reduction of 67%, so 2/3 of non-contact ACL injuries. But this is about really hard skills. So we know this is done. This has been studied, has been validated many times. So it is not an opinion, it is a fact. So injury risk reduction programs that are a mix of exercise does reduce injuries, does reduce ACL injuries. Really a lot. Cut 2/3 of all non-contact ACL injuries in women. I mean, this is important. However, you need to implement this program. So it's not really important the program itself. It is important the philosophy and the determination of you as a medical practitioner, as a head of performance, as whatever you want, as an athlete, as a father and the mother of an athlete, decide to implement this approach. This is more important than the program itself. Then, okay, the program will be okay. But the decision and determination to implement the program, this change everything, change the world. In fact, the problems are barriers in implementation of these programs. And so we need to talk about it. And we need to really consider also the context of sports in general. So in order to let the teams, the sports organization buy these programs, really, we are mainly speaking about performance. Do not speak with your athletes about injury and risk reduction. Speak about improving performance. In fact, these programs also aid in improving in the performance in multidirectional sports because it gives a little bit more dynamic stability to the lower limb. At the end of the day, this is also useful to perform better. So for sure, we know that these programs work, but the biggest challenge is on you, is on us to implement these programs. Then in terms of really tricks for implementation, you can also decide to target prevention, to tailor this performance enhancement and injury reduction programs on the patient profile, on the player profile. So you can implement tests that are important to evaluate the profile, but also to let them understand, because they need to cooperate. They needs really to understand that for him or her, this is important. Starts from why. If you don't start from the why for the hit, the why for them is the performance, you are not gonna have them buying the program. So injury risk reduction, prevention is about hard skills and soft skills. Of course, I like to speak about all the hard skills, so all the technical aspects, because I'm a physician, I'm a technician, I'm a researcher, I'm a scientist. So I like to speak about this, but I do believe that the most important things are really soft skills in implementing, deciding how to implement these programs.
Yes, I completely agree with you in terms of the hard skills and the soft skills. When I was just starting my sport medical career, so I was also like pushing on the hard skills. And then after a while, like more than 15 years working in elite sport, I realized that actually soft skills are very important in terms of implementing everything that you do, every protocol. So you should actually convince people to do this and explain their why to do this. So if a person understands why, so then slowly the progress will start. And here I think it's very interesting point from the hard skills, I guess, about if we can give to our who is watching us now something about the test that they can perform, maybe to make a self-assessment for some injury risk.
Yeah, absolutely.
And maybe some example of exercises that we can advise, or where to go and whom to see if there are any problems.
Absolutely, we can do this. So let me take the example of ACL injuries, because is one of the injuries that you want to avoid, and there is a large body of literature about it. So in order to understand ACL injuries, you need to comprehend the injury mechanism. So you need to understand how these injuries take place. So data from our studies and 20 years back in the literature are really clear. So these injuries are mainly non-contact or indirect contact in nature. That means that there is no direct contact on the knee in the vast majority of cases. The direct contact injuries, which are unavoidable or with strict rules, but we have strict rules nowadays, are 10-12%. The other around 88-90% are non-contact or indirect contact in nature. Non-contact means that you get injury completely alone. Indirect contact means with the push on the upper body generally, so with this perturbation. And by biomechanical perspective, there are several really characteristics, common features of these injuries across different sports. The first one is that all the load is on one limb generally. So there is really this aspect of limb dominance. So everything is on one limb. By a lower limb perspective, the lower limb is generally getting into valgus. So is buckling inwards, not outwards. So at the end, you have a X knee like this. So you got injury, you get an ACL injury in this biomechanical modality in the vast majority of cases. Then we need to address the trunk. The trunk is really important, and generally you have a homolateral trunk tilt. So you have a trunk sway. Your trunk stability is not perfect, and again at the lower limb, the knee is not bent a lot. Okay, so what happens during this injury? You are doing a change of direction, or you are landing from a jump, or whatever. that puts a lot of load on one limb. This, by a kinetic perspective, creates an external knee moment that has really a consequence. So a series of biomechanical events, one after the other, that brings the knee getting inside in valgus with shallow knee flexion and with the trunk that is generally tilted homolaterally, so is not in a good position. So all the exercises are targeting these aspects. So I explain you the biomechanics because this helps me in coupling with exercises. So the first group of exercises you need to consider are really what we generally call core stability. Core stability is not as easy as it appears. It's more appropriate to speak about really core strengthening, advanced core strengthening, or really lumbopelvic balance. It's about stabilizing the pelvis and the trunk three-dimensionally. So this is not as easy as it appears, but it starts with simple exercises. We publish different papers about it, and there is a bunch of stuff published that you can look to for sure. Then the second group of exercises are really plyometrics. Plyometrics means repeated jumping, and that's it. And this is really to train a little bit more flexion, a little bit more knee flexion, and a little bit less really stiff landing early flexion, where actually the ACL injuries generally occurs. The third group of exercises is the exercises to really really control the knee valgus, so the knee buckling in. And these exercises are generally based on feedback techniques. So basically, you can apply in intrinsic learning or an extrinsic learning, but the player really has to learn how to keep the knee straight during various activity. And you can do this only if he or she has an appropriate strength at hip level. So hip strengthening exercises, posterolateral hip muscle. So we are speaking about the abductors, external rotator, and hip extensors, and then feedback techniques. So advanced core stability exercises, plyometric exercises, is repeated jumping, valgus control exercises, and really a functional hip strengthening. These are the exercises that are at the core, really, of any injury reduction program. And the next step is probably getting these exercises in the sports context and considering the situational patterns that are more involved in the ACL injury really during the sports activity. So for instance, in football, these are defensive injuries. In basketball, these are offensive injuries. So you have to train the sport-specific situations that are at risk in each sport. And so this is just an overview. But the most important thing is to decide the program. And then you customize. Maybe you can decide the FIFA 11 plus. You can really type FIFA 11 plus or the really adaptation of the FIFA 11 plus. There are many. They are published, so they are free to use. And then you decide what to implement. Once you have decided, then you implement it in your daily routine. So I spoke a little bit about the technical aspects. Then you decide, you implement 3 times a week, and at least 4 times a week, and it is important the form of the exercises. So the movement quality is key to reduce injury. If you just go really in exercises with bad movement quality, you are gonna really increase actually the tissue overload because you are putting quantity. So it's not just about quantity, it's about quality of the loading that we are giving to really have an adaptation. So this is the overview.
It's very complex. Thank you so much for the overview. And I have so many questions in terms of the risk management, and would love to keep going here. But I think it's right now we should move a bit forward because we have still the part of the injury and the rehabilitation. So let's make the small overview. If injury happens, so what will be your advice? Put ice, don't put ice, use anti-inflammatory drugs, don't use. So what is the what the science is telling us now?
Okay, about injuries. Key after a lower limb injury. So you are an athlete, say, and you have an injury. You have to take care about the injury. So do not overlook an injury. This is very important. I repeat. Do not overlook an acute injury. If you overlook an ankle sprain, for example, an injury that is generally overlooked, so you think, oh, it's a simple ankle sprain, no problem, I will just really stay relaxed, a little bit of rest for 1 week, and then it's going to be all right. It's not going to be all right. So you have to take care of this injury, because if you do like this, you start a chain of injuries. 1, 2, 3, 4, 5, 6, 7, and then you have a lower limb that is load compromised. Once you have a load compromised lower limb, you start going on the other lower limb and you risk injuries on the other side. So the first stuff is take care about the acute injuries that happen. And if you have a chronic condition, if you have a chronic pain, take the time to heal appropriately. So take the time to really function and recover after the injury. And about injury management, it depends from the injury to injury from injury to injury, but there is a common line. There are mainly 5 phases that you have. The first one is mainly based on the control of the acute phases, control of the symptoms, control of the swelling, the pain, etc., etc., etc. And understanding well the diagnosis. That is not easy in many situations. So you need to really decide the most correct professional person for you. If you have a faithful professional figure, it is completely okay. But you need to look for competence, real competence in the specific injury. This is very important, and this is about the first phase. Then you have in this acute phase, early phase. Then you have a mid phase in which you take care about really the impairment that the injury have created, and then a late phase in which really you get a little bit more sport specific, and it is about on-field rehabilitation, it's about neuromuscular training, it is about this really transition from rehabilitation and performance. But first of all, do not overlook your injuries if really if you really have an acute one. To give just a practical advice in case of a muscle injury. So in case of a muscle injury, thigh muscle injuries, the protocol that you need to adopt is really to put ice, compress the muscle area, elevate, and rest for the first days, just to get the diagnosis. If you have a knee injury, you have a sprain, you have an ankle sprain or a knee sprain, it is the same. You have to put the ice, you have to rest the first day, but you need to really call the doctor as soon as possible. So do not yeah, this is important. I mean, it's but as soon as possible, call the doctor and tell him which is your problem, and really arrive with her to a diagnosis and then to a strategy to return to play. Because as doctors, we are focused many times on the diagnosis, or this is the knee, okay, you have an ACL injury, an MCL injuries, the meniscus is partially torn, etc., etc., etc. But what the patient is interested is really the prognosis. When I will return to play, in which way I will return to play, which probability do you have, which is the plan. So you have to have really your why, your mission, your vision, how you want to achieve your mission, and then a strategy, really a strategy to return to play that is a plan of action to achieve your vision, so to achieve your return to play. And this is really important. So setting a plan of action from the day 2 from the injury helps helps to see really the long-term goal that is return to play. And then you have those mid-term goals that helps in the rehabilitation, because rehabilitation is so straightforward. It does like this, with step backs, circles. It's not easy. It's not easy, especially if you have a long-term injury. So these are my overall suggestions.
Yeah, it's amazing. I completely agree with you here, because like it's very important to not be focused here on the injury and to be sad about, yes, the injury happened, but to have this vision of where you would love to be in 1
Oh, I lost you.
Important point that you just mentioned about that see a doctor. So of course, it's very important after the injury not wait that everything will be okay. So first of all, see a doctor and have a diagnosis and have this prognosis and have this plan from professional, not elaborate the plan by yourself. It's also will help you to recover faster and go back faster from the injury and don't have any chronic issues related to this injury. That is very important. Sure. And when I was preparing for our stream, I found a very interesting paper that was saying that around 50% of an athletes, they cannot keep going in their sport career because of the injury. So can you imagine? It's for me, it's very impressive number. Like you are training all your life or achieve your goal, and then like half of athletes cannot go there because of the injury. And that is why it's important to overlook the injury, as you mentioned, and I'm here completely agree with you. And the last stage of the injury process, as you started to mention already, it's about the recovery and rehabilitation, I would say. And yeah, what can here we advise in terms of the also some hard skills and soft skills in terms of the rehabilitation? Because yes, you should start with a very low loads and so on. It's a hard skills, and as you mentioned, have this vision and focus. It's the soft skill. So let's go a bit more in the details of the rehab programs, and so also where to run. Of course, run to Isokinetic chain of clinics first. And then maybe we can make some other advices.
Absolutely. So in our method, we really focus on the complete recovery of neuromuscular function after each injury. So first of all, you need to re-establish joint homeostasis and to maintain joint homeostasis. Speaking about any injury, for example. Then it comes to strength, isolated strength. So isolated strength of knee spanning muscle come first. This is very important because nowadays, then I will speak about the sexy topics, but the sexy topics happens afterwards. Before, isolated strengthening is really key. In knee injuries, for example, in the recovery, the strengthening of the quadricep muscle is probably the #1 factor, the most important thing that you can do. So isolated strength come first. Isolated strength of all the lower limb muscles. Then second is about really targeted neuromuscular training. So once the strength is enough, we create a progression of movements in order to re-establish a correct dynamic stability of the lower limb. So we speak about really the re-establishment of the correct squatting pattern, single leg squat pattern, and then moving, drop vertical jump, lateral shuffle, deceleration, single leg up testing, and then change your direction. So this targeted neuromuscular training program is based on tests, movement analysis tests that can really give us an idea on the movement profile of the athlete. Alongside the isokinetic testing, it gives idea on really the strength of the athlete. So you know physiologically how an athlete is, you also have to know psychologically where he or she is. We do it after ACL with the ACL RSI schedule questionnaire. And then after this phase, you test again, and we do it inside sort of biomechanical labs that we call the green room that are implemented in our centers. These are open spaces dedicated really to movement analysis and movement training, target movement training. These spaces, they function with the biofeedback techniques and with the video wall, which the patient can really see him or her at the natural aid with a series of feedbacks, biomechanical feedbacks. After this phase, so target neuromuscular training comes second. After this phase, there is really on-field rehabilitation. On-field rehabilitation is about really reestablishing the sport-specific profile. So the recovery of the sport-specific profile, the sport-specific gesture, and we do it on our pitch. So we have on-field rehabilitation specialists in each clinics, and we are monitoring the external load with GPS technology. So this helps really to reestablish the correct chronic training load for each sports. So the overall suggestion is target the neuromuscular function. Don't limit your focus just on the knee or on the ankle or on the hip. It's about the whole patient. It's not about the knee. So if you treat the knee, you can fail. But if you treat the patient, you never fail. So don't treat the knee. Treat the patient that has a knee condition. This is our key, both hard and soft skills. But in terms of hard, muscle strengthening isolated comes first, targeted neuromuscular training comes second, on-field rehabilitation comes third, and then there is a reintegration with the team. So this is how we work.
Perfect, that's amazing. And the point about treat the patient, don't treat the knee is very important, because it's very complex and you can go from the different angles, not only in terms of the rehabilitation, in terms of nutrition, in terms of psychology, in terms of different advices that you can give to an athlete or to the patient who is having this type of injury. In terms of the rehabilitation, what do you think? I just wanted to ask about these fancy rehabilitational tools that are using now I saw in different clubs, for example, Ultra G, anti-gravity treadmill, or hypoxic training is also used for the improve the cardiovascular function during this period of recovery, water treadmills, and so on. So what is your opinion about these fancy things, or it's like too much and you can go with a very basic rehabilitation tools?
So honestly, there are no magic tricks. So
how come? How come?
So there are no magic tricks. So there is no magic.
I was expecting
drug.
so much that you will say that I have my magic trick that will treat
everyone.
There
is no magic trick. There is no magic drug that you can use. Every piece, every tool, every instrument, every specific treadmill that you have is to fit really in your strategy, in your philosophy, and everything can help, obviously. But rehabilitation is easy at the end. It's about optimally progress load in respect of a load compromised athlete. So it's really it's training in presence of an injury. That's it. This is rehabilitation. So you have to really progress the load. So the things that you mentioned, the Alter G, the water treadmill, we really use improved rehabilitation. So we use treadmills inside our pools in each center. Really, these are all stuff that can help in the load progression. Yes, so they help, but they don't solve. It's how you use it. This is important. It's more important. And so how you implement this load progression and how you personalize for each patient, this is the number one priority that I want to stress here, not the single tool. The single tool may be useful, but to be honest, if it is without really a sense, without this sense of progression, is not useful. It's not useful.
Yeah, that's important that it is part of the program, not it's like tool for the rehabilitation. It's part of the complex program where all these tools are implemented. And yes, it's very important. We are coming to the end of our stream, and I would love to move a bit to the soft skills issue.
Mm-hmm.
And here I would like to stress the topic about what you can advise for an athlete in terms of the attitude to be successful. In your opinion, you worked with a lot of elite athletes, and I think you can share some of their attitudes. Very interesting.
Yeah, this is a very nice question, and it's nice to close with this. First of all, I mean, the athlete's body. I mean, speaking about the top athletes, professional athletes, but even not professional. If you want to really be an athlete, your body is a temple. That's it. This is a very common feature. Your body is a temple. So top level professional athletes are very serious in considering everything around their body. I remember a former NBA player that told me, really, Francesco, I make money out of it. I make money out of my body. I mean, you have to take care maybe about other stuff, but I need to take care about my body. This is important because this is my company. So my company is my body. So your body is a temple. This is very important. This is really very important. And so that means that even the lifestyle is really dictated by this, and this is absolutely crucial. If you want to be a top athlete, you have to adopt a top athlete mentality. That's it. I mean, it's not good or bad. It is what it is. Then the second aspect is the attitude. They are determined. They are determined to success. They are determined in rehabilitation. They stay more time. You know how many sessions a professional athlete generally does in terms of rehabilitation a week? Is around 11. Wow. 11 is 2 times a week, sometimes 3 times a week, 2 times a day, 2 times a day. So in the morning, midday, and afternoon, or morning and afternoon, every day, with appropriate nutrition in the middle, and also the Saturday morning. This is determination. They are determined to succeed, and so they put a lot of energy. So having the correct lifestyle, and then when there is a problem, they are determined really to solve this problem. I don't know if you have the same kind of experience or the same kind of vision. I would really like to have also your perspective over there. But I think that these two parts are really very important. These two aspects of an elite athlete, these are keys for me.
Yeah, here I completely agree with you in terms of the attitude. And actually, I was seeing how the athlete is growing from the becoming more professional. So I work with different athletes, and sometimes I really realized that elite athletes are not so professional that I was waiting they will be. And then, sure, of course, different issues are happening, injuries and overtraining and other issues that also are related with this attitude. And with the years of it's like experience, years of practice, years of understanding more of their body. And this is what I actually learned from the elite athletes, that actually, yes, I read a lot of books. I had my experience working with the different athletes. I can give some advice from the scientific literature, how different things can work and can help in achievement of the performance or improve their rehabilitation or other things or recovery. But elite athletes, he knows everything about his body. He already knows what is working for him, what not. And for me, it was very important to understand, to hear elite athlete about his what is working for him, what not, and if we tried something new. So he was feeling actually this better than any device that I was measuring the changes, sure, in his body. So it was very it's very enjoyable to work with elite professionals because they like feel their body and they have a very strong connection, I would say, with the inner feelings because they did so much of this special work, so they feel it on the fingers, on the tip of the fingers.
Yeah, I completely agree, completely, and it is very interesting every time to experience really a talk, just a simple talk with an over 30 professional athletes. Generally, I'm always learning something. So because the over 30 professional athletes is a master of his body. Master. He knows everything. She knows everything about his or her body. You cannot tell them pretty anything, to be honest. You can just help them in understanding a little bit more, but they are very well aware of what's happening. And this is not the case of a very young professional athlete. That is the opposite. So you need really to adapt your vision. But it's not really, it's also a little bit about the age, because over 30 professional football players, that means that he or she played for many years. So, I mean, experience over there is a factor at the end of the day. But it is also a question of attitude, because you can have also competitive recreational player, not at the professional level, that does behave in the same way of really over 30 professional athletes. And these attitudes that we find here and there is very nice when you have it, because you recognize the pattern. And when there is this pattern, you can bet that this athlete is going to give everything of himself, of herself, because she is or he is interested. They have a passion. So these people has a passion in what they are doing. We have also athletes that doesn't like very much their sport, but they do perform well. But these are not this type of athletes. So when you are young and you have this attitude, you really like what you do. So the most important thing in life, I think, is to like what you do. I like to come in my office in the morning. This is a good thing for me. It's beautiful. And it is the same time, the same thing probably for you, or for our athletes, for our patients. It is really the same. They have to enjoy. If they don't enjoy, it is very unlikely that they adopt this really very rigid schedule. Your body is a temple, determination, and then I know my body very well. Generally, they're on the other side of the middle.
Yeah, it's so great. I'm just feeling so excited to hear these words from you. And actually, I really wanted to switch the focus from the athletes to our part, to health professionals, for scientists, and everybody who is working around the athlete, because like we also are elite professionals who are working as a team behind the athlete. So maybe at the very end of our talk today, we can also give some advices to young professionals who is just starting their career in sport medicine, sport science, sport nutrition, maybe how it's called, rehabilitation, physiotherapy.
Physiotherapy, okay.
Yes.
So nice, very nice to close in this way. I like very much to close in this way. So first of all, guys, the young guys, for the young guys, do something that you love, do something that you like. Don't stay stuck doing something that you don't like, because at the end of the day, life is a beautiful journey that we need to also enjoy. And if you love what you do, you will give 100%. And then the second piece of advice is live always an international dimension. Living an international dimension allows you really to interact with many different cultures, many different people. This is what we try to do with our conference. The Isokinetic Medical Group conference, his mission is really to inspire the sports medicine community to give their best for the world's health. This is what we do. Really create this hub for people to interact. But this is just one situation. You can have many. So when you have the opportunity to live in the international dimension, live it, because this is really, really, really wonderful. And the third piece of advice is never stop dreaming. If you have a dream, work for it and work hard. Working hard means to put a lot of hours. Don't stop at the first difficulty. Don't stop at the second difficulty. Don't stop at the third difficulties. There will be mountains that has to be climbed, but it is okay if you are determined to succeed. Then dreams can come true. This is very, very important. So do what you love. Always live in international dimension and follow your dreams. The fourth one is work hard. Work hard. Hard work pays off. That's it. Probably this was what our generation was thought about, but really hard work pays off. That's it. If you work hard, it's very, very difficult that you don't succeed. And another really point that get to my mind, because this is improvisation, is also don't work by yourself. Work with other people. Create a group. Work as a team, really. Work in team. Because alone, we are not so strong. But together, we can be really, really strong. And we are always dealing with the same mission. It's about helping people, helping patients to recover from an injury, helping an athlete to win a medal, etc., etc., etc. Or really changing the status quo, publishing important papers that let the people understand, and maybe outpace you in the future. Because true leaders really allows their students to outpace them. This is very important. Very, very important. If not, knowledge will not develop. So we need to believe in young people. So that's it. These are my take-homes for the health professionals. Do you want to add something, Irina?
Amazing. I just feel so inspired after your talk, and nothing to add, actually. It's really great point that you mentioned, and I'm really 100% agree, and especially with the team's point that, yes, the team is very crucial, important, and is important to help young people to go forward, and we're here to help. Yes, it's like step by step. I hope, like, the spreading the knowledge that we are doing today with you, I hope more people will be get involved into the latest research, data, and latest updates in the medicine and sport rehabilitation, and apply it, the most important part. Not only know, but apply it to the practice. This is important. Yes. Thank you so much for talking today. It was so lovely. I really enjoyed.
No problem. Thank you very much for the invitation, and ciao, ciao.
Ciao, ciao. And everyone who joined us today, thank you so much to being here with us. Thank you, Francesca. Bye.
Ciao, ciao, ciao. Thank you.
Ciao,
bye,
ciao.
bye.